What is emotional flatlining versus anhedonia, and why does it matter? In this video, I'll explain the difference and why it's critical that you know this if you suffer with either of these conditions. Now, I'm Jackie Kellum. I'm the founder of Anhedonia Support, and I am not a doctor. This is not medical advice. This is my opinion based on having and overcoming both anhedonia and emotional flatlining and helping many others do the same. So let's begin with anhedonia. This is a term used by mental health professionals to describe a condition where you essentially lose your ability to experience pleasure. So life feels sort of blah. You're not really interested in things you are interested in. You don't want to hang out with your friends. It's really a type of depression. And to explain more about what it is, I like to use a metaphor of your brain as a series of pathways or hoses through which neurotransmitters flow. And neurotransmitters are things like dopamine and serotonin, which make you feel good. The more that are flowing, the better and the happier that you feel. So using this metaphor, I think of anhedonia as if someone has actually squeezed the hose. And so less neurotransmitters are getting through. So you don't feel as good or as happy as you do when those pathways are wide open and flowing. And the more squeezed down they are, the worse you feel because fewer and fewer neurotransmitters can get through. So if you go to the doctor and they diagnose you with anhedonia, often they will give you a medication such as an SSRI, which is a serotonin reuptake inhibitor. And essentially what they do is increase the amount of serotonin in your brain. And so for people with anhedonia, this can make you feel better in some cases because now you have more neurotransmitters flowing through the pathways. Now, there are many other ways to increase the amount of neurotransmitters flowing, such as diet. Diet actually plays a huge role in mental health. And if this is new to you, I recommend the book Brain Energy, which will help you learn more about that, along with there are supplements as well. Brain stimulation can help and other techniques. My personal favorite for dealing with anhedonia is a combination. I won't go into it here, but basically it's three things. First of all, diet change. And that Brain Energy book can give you some input on that, along with thinking modification. And there's a book by Alex Korb I like called The Upward Spiral that I think is fantastic for learning how to work with your thoughts. And then if you're dealing with something that's more serious, then I think somatic therapy is the best therapy. I think it's much more effective than a lot of the traditional talk therapies. And so those three are my personal favorites when it comes to dealing with anhedonia as a type of depression. Okay, so that's anhedonia. And frankly, it's the only condition that most mental health people recognize or know about. But there is something far worse, I believe, and I call it emotional flatlining. I had both, so I know. An emotional flatlining is a different condition altogether, and it needs to be treated different. Now, this is a term I came up with because there's nothing out there to describe it. So going back to that hose metaphor again, anhedonia is like the squeezing of the hose and reducing the neurotransmitter flow, while emotional flatlining is like breaking the hose, kinking it off completely. You feel absolutely nothing. I mean, nothing. So here's some examples. So I've had mothers come to me. They've had newborn babies, or even during childbirth, they could not feel a thing. They hold their baby like they would hold the newspaper. There's absolutely no feeling, nothing. Another way I try to explain the difference is if you were to win the lottery, you would feel absolutely nothing. I mean, nothing, not even like a slight little glimmer of excitement, nothing. Another thing is you can't feel grief. So someone that you love dearly could pass away and you would not be able to cry or feel sad or grieve, which gets confusing because you think of this as a negative emotion, but grief actually requires the reward pathway because you have to love or care about somebody in order to grieve with them. So this is often very confusing. And what makes matters worse with the flatlining is that you can still feel the negative emotions. You can still feel angry and sad and depressed, because it's the reward pathway that's broken, and it's a different pathway than the one that creates the bad feelings. Now, some people do actually lose both the good and bad, but in general, most people lose the good. Now, if you go out onto the internet and you start searching on forums with people who have anhedonia, which I do not recommend, it will only make you feel worse because you will see people on there who've had this condition for years with no improvement. And it's because they are treating it like anhedonia because they don't know any different. The medical community doesn't distinguish it. And so they try supplements and SRIs and brain stimulations and all the things that will help for anhedonia, right? The type of depression, but they do not help flatlining, because to fix flatlining, you have to rebuild the reward pathways. So increasing the amount of neurotransmitters is not going to help because the hose is broken. So it doesn't matter how many neurotransmitters you produce, they can't flow. So another way to think of flatlining is like a stroke in the brain. So let's say you get a stroke and you lose the ability to move your arm. And they used to think this was permanent, but now that through neuroplasticity, they know that you can often get that back by stimulating the part of the brain that would move the arm. And so in order to do that, they give you exercises where you try to move your arm. At first, nothing happens. It takes time to build those pathways, but eventually through neuroplasticity, if you keep trying, the arm will start to move as those pathways get built. The same thing is true for flatlining. You have to rebuild the good feeling reward pathways like you would an arm by stimulating them. And this takes time. Now, if you go to my website, you'll see a free program I have with the best exercise for doing this. And you basically have to keep doing it every day. This is really hard because when you have flatline, you have absolutely no motivation, no interest. And on top of it, nothing happens for weeks. So it's really, really hard to stick with it. But many people have gotten their feelings back by doing this, myself included. So I know it works. All right. So that's a brief overview of the difference between anhedonia and emotional flatlining. Again, it's really important to know the difference because they need to be treated very differently. And on my website, I have a checklist that can help give you an indication. It is not a diagnosis of any kind. For that, you always have to go to your doctor or mental health professional, but it can be an indication of perhaps which side of that fence you fall on. So that's it for today, my friends. And if you want to learn more, you can visit our website or hit the subscribe button so you'll be notified when the next video comes out. Take care. Bye for now.